My name is Andrew Atterbury. I go by Andy. I am a third-year student at the University of Pittsburgh School of Pharmacy. They have an accelerated program, so I only did 2 years of undergrad, so I guess technically I'm in my 5th year of legitimate college, and that's confusing and I have to explain that every time. By now, it's my last year of lecture, and by now I've learned enough to the point where I want to stop sitting in class and rather get out and go do something, take everything I've learned and push it towards a goal. So now I'm more focused on creating, getting involved, engaging myself and growing my network, finding people who have complementary skill sets that we can work together to accomplish something. I'm not a Pittsburgh native. I am from Columbus, Ohio. Not too far away. It's only about 3 hours. It's closer than Philly, actually. People from Philly don't like it when I tell them that. And I've been here for 5 years, but I did come here multiple times a number of years before that because my sister went to school here. So I would come up and visit her pretty often. She's only 3 years older than me, so I would just drive up and hang out with her for a weekend. To me, health activism is, in a sense, I guess a more engaged form of altruism. So people who work within the healthcare field, have this innate sense of altruism, a desire to help other people, non-selfish and generous. But health activism, I think, is, within healthcare, you can kind of blur the lines between what's altruistic and what's not. And I think in activism, in a sense, it's a more engaged form of that, where you're going out, you're listening to the people that you have pledged to help. You are not projecting solutions onto them, but asking them, what are the problems, and what do you need, what needs doing first. I find that sometimes healthcare is not the most engaged with the patient, so to me health activism is engaging the patient in the utmost way, rather than expressing your expertise onto the patient, saying accept this or do not accept it. I am very passionate about giving, I guess, patients a voice. It's interesting, it kind of ties into my schooling. When I first started in the pharmacy program, I felt very powerless. I felt like I didn't have a voice, and I felt overwhelmed at times, and I felt like professors were giving an excess of assignments, projects, things to me, and that I couldn't ask them, hey, this is too much, hey, I don't understand this. And I felt like that was applicable to the patient and provider standpoint, where many times a patient is just told, do these things, it's for the good of you, but the provider doesn't have the time, the resources necessary to explain that to them and to make sure that they understand the care that they're receiving. So in the sense that I wanted to give students a voice and an ability to negotiate with their professors about what is and isn't good for them, I kind of want to do the same for patients, and I think my project ties into that a little bit. It's focused on, in a sense, activism and advocacy for the patient, kind of demanding a seat at the table and recommending, a wider range of options for patients who might not fit or have been burned by our traditional healthcare system. I initially got wind of the Salk Fellowship from a pharmacist that I was working under. For the school of pharmacy, we did these little one-week rotations at different sites. I was at a hospital out in Wilkinsburg called Life Care Hospital, and my preceptor was so amazing. She was fantastic. She worked with behavioral health patients, which is a nice way of saying like mentally ill patients, a lot of schizophrenics. She had a really tough job, but she was young, she was passionate, she was very engaged with her patients, and because their hospital system was small, she had to take on a lot of responsibility. So despite all of that, she was still able to be a really good and accommodating preceptor for me for the week, and in like the middle of the week she got this email about like, hey, the Jonas Salk Fellowship is coming up, apply if you want to. And she said, hey, I did this when I was in pharmacy school. I did this twice, and I thought it was fantastic. It really helped me develop as a person and a professional, and I think you should do this. So she sent the link my way, and she was like, and I'll write you a letter of recommendation if you do it, because I think that you would be a really good fit for this. So just having that guaranteed, like really like put it in my mind, like wow, I should probably do this. She probably like really believes in me about this. So yeah, Dr. Pinchowski was really important in that. My project during the fellowship is going to be researching the potential patient population that is going to be utilizing the incoming implementation of medical marijuana in Pittsburgh. I'd really like to get a good understanding of what kind of patients will be using this new therapy, what kind of challenges they might face, what kind of disease states they will have, and hopefully I can do a survey of patients or potential patients in Pittsburgh to see what kind of challenges they will face being medical marijuana patients, and how best to anticipate those challenges to solve them before the program gets really up and running. It's been passed in law, but it hasn't really been implemented yet, and there are still a lot of things that can be done to ensure that it's smooth, that the patients that need care can get it, and that the patients that are getting care can be treated equally in the eyes of the law. I have always been sort of passionate about this, but I never really thought of this as something that I could foreseeably do because it's kind of taboo in the medical field, until I came into contact with one of my professors at the School of Pharmacy. He really empowered me, and he really laid out a lot of the problems that Pittsburgh is going to face, and how pharmacists, being those trained in the administration of drugs for patient use, are really like the most equipped to take on this challenge. And he really laid out to me the urgency of the problem. Like, there's so many problems we gotta face. It's such an uphill battle with legislation and enforcement. There's like them flipping the switch on this in this time, in this framework, is going to face a lot of challenges. So we need people like you, people who are empowered, understand the drug, understand the patients, have the resources and the networks to incite change. Like, there's always going to be opportunity there, and this is something that you can legitimately pursue because you're in the best state to do it. And I didn't really understand that until it was like laid out to me, and since then it's been like full time. Like, how can I anticipate this? How can I solve all the problems? And that's getting me a little off base because there's so many problems and I want to solve them all, but I know I need to refine them, which is, I think, what the Salk Fellowship has helped me with so far. People working in like the LGBTQ community are really inspiring, because like I think that there was much more stigma against that population than the population I'm focusing on. But these people pushed forward and wanted care for their people, despite a backward system, discrimination in practice and in law, social stigma, all of those things. I really look to some of those leaders for inspiration. I think that understanding that I have set myself up nicely for what I want to do. I went to pharmacy school under the pretense that I was just going to go into the healthcare field. It was going to be guaranteed job security, good pay right out of college. It wasn't really for the purposes of this, but I'd always had this in the back of my mind. Like, I remember thinking when I was in high school, medical marijuana law was coming into effect in Ohio, and I thought to myself, wow, wouldn't that be cool if that would pass? That could really help a lot of people. But those thought processes were kind of separate in my mind. So being able to bring those back together and understand that the position I have sets me up kind of perfectly for pushing the cause that I want to push, like, really nicely. Understanding that and having an older, more seasoned pharmacist say, you can do this, is well within your rights. You're a gifted young kid, you can solve the problems, and there's going to be a lot of problems, so don't ever worry about not having job security or falling behind your peers. just that realization that this is something worth pursuing, that people can really benefit from this, that the skills that I've accrued over my time, over my 5 years here at the University of Pittsburgh, you know, have really set me up for specifically to tackle this problem, and that even if I don't do a residency or work in a community pharmacy like Walgreens, that it's still a valid profession. Like, I'm still using my pharmacy degree in a way that's helping patients, even if it is non-traditional. When I was 16, I climbed the tallest mountain in the continental United States. It was very difficult. It's in Colorado. It's called Mount Elbert, and it's like 14 something something something. It was very tall. I was exhausted. It took me like 3 days. My friend got sick and almost died. It was quite an adventure, and I'd like to think that my time hiking and camping and backpacking out west really influenced my progression as a human and as a professional. And I guess that's one that people wouldn't expect. I don't know, I've climbed to the tallest point in like 17 or 18 states. Some are really tall, and some are not that tall at all. Like, the tallest point in Kansas is just a little hill. It's not, yeah, it's nothing.